Hello, welcome back to Howhaven. This is part 2 of Vaccine Mobile Delivery Success Now. How to get the vaccine for COVID-19 coronavirus ASAP. A new, federally driven focus on mobile vaccine delivery services is in the works that will have a great positive impact on access to COVID-19 vaccination for citizens who are homebound or those who, for many reasons, don't have the access to vaccination sites. The good news is mobile help is available now in many places across the country. If we dig a bit deeper into mobile vaccination programs and how they come into being, there is much that local communities can learn in recreating successful mobile programs across the U.S. Take, for instance, the city of Long Branch in New Jersey. In a recent interview with Gloria Wright, the executive director of the Long Branch Housing Authority, or LBHA, she described how their model for success and how their mobile vaccination program took shape. The LBHA is responsible for 3 public housing buildings, which include about 200 seniors. Long Branch Housing Authority leaders were concerned that their eligible senior residents would not be able to access vaccination sites for appointments due to the following problems: limited physical mobility or simply being homebound, lack of ability to access transportation, inability to wait in lines for long hours or in unfavorable weather, absence of computers or the lack of cell phones that could access vaccine registration sites. In some cases, the residents simply did not have the technical savvy to file registration online. While all too often call center systems are unavailable due to being overwhelmed with calls. The solution process began with LBHA partnering in the project with private housing organizations to help administer vaccines to their own seniors, the City of Long Branch, especially the Mayor's Office, the Visiting Nurse Association, and the Long Branch Office of Emergency Management, OEM, supported by FEMA. Okay, the partnerships were in place, but who is going to do what part of the plan? That's where the Long Branch Housing Authority created an MOU. What's an MOU? It's a Memorandum of Understanding, and it's a write-up created to coordinate the effort so that every partner in the project would be clear about their role. In the words of Executive Director Wright, with the permission of the tenants and assistance from the LBHA, the City of Long Branch jump-started the process by agreeing to assist public housing residents to register, as information like their age, address, and phone numbers are part of the process in registering for access to public housing and is needed to register for COVID-19 testing and vaccinations. She went on to say, to begin this process, the city and the LBHA issued notices to residents, posted flyers in the buildings, and made robocalls to residents of their intent. Then they canvassed each apartment by sending a city employee with automated tablets and notebooks, often accompanied by LBHA staff, to knock on doors, explain their intent, and ask each member of the household if she or he was interested in registration to obtain the vaccine. Each of these steps worked. Shout out to the City of Long Branch employees. The area's Visiting Nurse Association received the necessary information to administer the COVID-19 vaccinations to the local public housing residents who needed to receive their vaccinations right there where they lived. Shout out to the Visiting Nurses Association across the country. And for those who could leave their home but had no means of travel to a distant vaccination site, a local community center under the stewardship of the Long Branch Housing Authority was earmarked as a vaccination site. The Adam Bucky James Center was made available to the city as a new mass vaccination site in the heart of the entire community. This was a logical choice because this site was already being used by Monmouth County for COVID-19 testing, for city residents and the public in general. The LBHA again coordinated with the city of Long Branch, who provided the transportation for these citizens at no cost to and from the site to get their first vaccinations. Overall, the level of cooperation that was exercised with the various partners who brought their own skill sets, areas of influence, and ability to marshal resources from a broad spectrum of expertise blended together in harmony for the intended result: getting vaccine doses in the arms of citizens for the current phase of eligibility. From each organizational group to each single individual participant, the Long Branch, New Jersey community showed how to collaborate for timely vaccination success. In this way, the Long Branch Housing Authority, City of Long Branch, and the Visiting Nurse Association created a model for success to other communities in New Jersey and across the country. The solutions are out there. The trick is to create strategies that have already been proven to work. Shortly after Long Branch had their success, the neighboring borough of Eatontown, New Jersey, began doing the same. Eatontown followed a slightly different path, with leadership from their mayor, Anthony Tallarico Jr., who also actively works as a registered nurse. Shout out to our registered nurses. In Mayor Tallarico's words, "We have had the infrastructure in place for a while. We have an amazing OEM community and strong relationships with the local senior housing management company. We also have a great relationship with the New Jersey State District 11 Senator and Assembly members. All have been working behind the scenes. All we were waiting for were the vaccines. And that decision was made much higher than they are." He went on to say, "There is also another program we're working on. As far as bed-bound and immobile patients, the borough of Eatontown has a registry-ready program, and we have been engaging with residents in this group." The good news for the mayor and neighboring residents is that current plans are in place to ramp up supply to everywhere in the U.S., and the vaccine supply limitation may change very soon. Even so, there's something each local community can gain from and take action on through the examples that have been just reported to you. So let's go make it happen and get our neighborhoods vaccinated across the country. If you found this video helpful, please hit the like button below and also subscribe to the channel.